Hi, my name's Lee Matthews and I'm a specialist pain physiotherapist. I work here at the pain management department at Queen's Hospital, and today I'm going to guide you through a series of exercises that are aimed at rehabilitation of a certain muscle called multifidus. Now this muscle is very specific. It sits between each of the levels of our vertebrae, and because it only crosses one joint level, it's actually quite important for fine-tuning of movement. It allows us to carry out our day-to-day functions and we barely even notice they're half the time. Why it's also important is with back pain, especially if we've had it for a long time, this muscle can get quite deconditioned, and we often know that from looking at people's MRIs. We can see a decrease in the muscle bulk, and what we also know is that when we look at a cross-sectional view, you can often see what we call fatty infiltration. So the muscle becomes less its normal self and more reduced in bulk, and the type of muscle fibres there. Well, the good news is that we can actually do exercises that target strengthening that, and with consistency and over time it can actually have positive results. The exercises themselves can be quite specific, and that's why I'm going to guide you through them now. So we'll do a series of them in different positions. Some of them will be laying on our back. I'm going to guide you through some laying on your front, and also some in a 4-point kneeling position, so in a crawling position. And for some of you, you might not be able to do that quite so easily, so we can adapt those to doing them standing, leaning against a table and things. So let's bring ourselves to laying on the bed. I'm going to use this plinth here, and for you at home you might use an exercise mat on the floor, or it might be that you do them laying on your bed. I'm looking for about 90 degrees at your angle of your knees. My feet are flat on the bed. You might use an exercise mat at home, or you might be doing these on your bed if you can't get on and off of the floor very easily. I'm looking for a long neck, so my chin's not poking up to the ceiling, reasonably wide with my shoulders. Make sure you've got sufficient support under your head, so just a folded bath towel, a small pillow would be the sort of thing I'm looking for. Now, we want to make sure that our pelvis is in a nice neutral position. So one of the first things that we're going to do is just practice flattening the small of the back into the bed and then coming back to the other extreme there. So it's kind of rocking the pelvis. If you're not sure what you should be doing, pop your hands underneath the small of the back if your shoulders allow it. And again, if I slowly try and push into my fingers there, they're in the small of my back, and then rocking back down again there. So what we're looking for is that nice neutral position, so neither one extreme nor the opposite. I'm not overarched away from the bed and I'm not squashing too far into the bed. I want that nice middle position there, and that's what we're looking for all of the following exercises. What I'm then going to do is look at trying to recruit the muscle that's that deep core there. We know when we activate this, it's also going to activate those multifidus muscles. So locate your belly button, and then if you bring your fingers so they're just a couple of inches either side there, it's just above where the bony bit of the pelvis is. Now if I relax totally, if I let my belly go a bit floppy, and then if I, from that relaxed state, it feels quite soft and squishy around here. But if I go to cough, if I go to laugh, or if I imagine I'm trying to stop myself from having a wee, what you'll find is you notice that muscle just tenses up a little bit, and that's exactly what we're looking for. So probably a slightly more polite way of framing it is if you imagine that you were trying to do up a really tight pair of trousers that you're a bit too big for, and you're just trying to draw that tummy button in a little bit, draw that belly in a little bit. I hold it for 5 seconds and then I relax again. Now, you don't have to have your fingers there, but that's just so you've got some awareness of what we're trying to do. And again, that first exercise is going to be trying to do 10 of those contractions for me. So again, scooping that tummy in slightly, drawing that belly button down towards the floor, hold for 5 seconds and relax. And when you're doing this, I want to be breathing normally, so it's just this contraction coming from here. So here we go again, just drawing that belly button in, and then relax again. And I'd be aiming for you to do about 10 of those ideally. That's good. So we've got used to the principles of engaging the core. We found that pelvic neutral position, and now we can increase the load further by doing a small alternate leg lift. So what I'm aiming to do with this one, I find that nice neutral position, make sure you're staying in neutral there. I go to engage the core, and now as I'm holding that, I'm just looking to do a small leg lift off of the bed, and then back down again. I relax, and then I do the same on the other side. So again, engage the core, draw that tummy button in, and the same on the other side, and down again. And again, draw the tummy in, and I'm aiming to do 10 of those on each leg, alternating each time. So that's the last of our multifidus exercises that are laying on our back. And now we're going to apply the same principles to laying on our tummy. So we've done those multifidus exercises laying on our back. We've become familiar with the principles of engaging our core muscle by drawing that belly button in. We've also got familiar with tilting the pelvis back and forwards to find that neutral position, so we know that it's nicely engaged and keeping stable there. And now if we lay on our tummy and apply the same principles, we're going to be using gravity a bit more as resistance. So let me show you how to do those things. I'm going to be laying on my front. I've got a plinth with a hole in it. You haven't at home, so it might well be that you fold up a little towel, like a little hand towel or something, just to give you some support under your forehead. If you've got your pillow again, this time we're aiming for it to be underneath your hips roughly. So here we go, I'm going to lay on my front. And when we brought ourselves into this position, first of all we just need to make sure that pelvis is in a nice neutral. So again, it might be curling one way and then poking your bottom up until you find that halfway position where you've got a soft curve in your back. The other thing that we also want to do is have the arms out, either outstretched, and if your shoulders aren't quite that mobile, it might be more of you're under a rest position. You ideally aiming to have your forehead rested, so your head and your neck are nice and relaxed. And from this position, first of all, just engage that tummy muscle. This time obviously you're lifting the belly button up towards the ceiling, and I can hold that for a few seconds and then relax. Now, if we want to add some extra resistance in there, what we're going to start doing is engaging the arms and the legs, and we're going to do that very specifically. Now, first of all, with my shoulder blades, I just want to make sure that before I go to lift up any of my arms, that I'm keeping that shoulder blade back and down, so it's almost like it's back towards my waistline of my trousers. I can engage that core muscle again, so I'm just drawing my tummy button in, and then from that position, either with your arm up here or down here, keeping that shoulder blade in my back pocket, I'm just going to lift that arm for about 10 seconds there and hold, and then relax again. And when you've done one side, let's do the same on the opposite shoulder. So again, from a position of keeping that shoulder blade in your back pocket, I'm going to engage my tummy muscle, keep the pelvis in a nice neutral position, and I try and lift the shoulder up there, and hold, and then back down again. So 10 seconds with one arm, 10 seconds with the other arm. And now let's take that to the legs as well. Now, because we want to shorten the lever length, I'm going to bend at the knee for about 90 degrees. Again, I'm going to engage my tummy muscle, and keeping that nice curve of my back, I'm going to just try and lift that knee very slightly off of the bed. Now, you might well feel some of your glutes working, but we're also going to be using that multifidus muscle. There we go. And then let that come back down again. Now, you shouldn't be overarching from the back there. The back should stay completely still. Remember that imaginary tray of drinks that you want to keep still there. You don't want to drop them at all. And now let's go to the other leg now. So again, I bend to about 90 degrees at the knee. And what I'm looking to try and do is I engage my tummy muscle, and keeping that nice soft curve of my back, I'm just trying to bring the knee off of the bed just a few millimeters. and then back down again. So we've done one of each of the arms, one of each of the legs. We do 2 rounds of that to begin with, so here we go. Let's go back to that original arm that we were using. Again, post that shoulder blade into your back pocket of your trousers, engage your tummy muscle, and then trying to lift that shoulder, lift that elbow, keeping that hand nice and level off of the bed for 10 seconds. And down again. And now the same on the other arm. Here we go. Engage the core, lifting that tummy button, keep the shoulder blade in your back pocket on the other arm, and again, trying to maintain that gentle lift of the arm off of the bed. And back down again. So we've done 2 on each of the arms now, and let's do the same on the legs again. So again, bring your knee into about 90 degrees, engage the core, remember to keep that nice soft curve of the back, and then I lift the knee so it just clears the bed, holding that position, 10 seconds, and then back down again, and finally the same on the other leg. So again, scoop up the tummy button, hold that position, and let's just lift that leg clear of the bed, holding for 10 seconds, and back down again. So to begin with, for many of you, it might just be 2 rounds that we do round the clock of one arm, the other arm, one leg, the other leg. And remember, by bending the knee there in that position, effectively we're reducing the strain on our back. What's absolutely imperative through all of these exercises is maintaining that control. If you start to overarch the back, or you're not maintaining that control, you're actually recruiting the wrong muscles there, so it can be undesirable. So always listen to what your guidance has been given by your therapist. Try and maintain that good position throughout, and if you're not sure, then you can always ask. But we'd be looking to slowly build up the endurance of those muscles, and it might be that after you've done a couple of sets and been doing that for a while, you'll then progress to doing multiple amounts of those. The other way that we can also progress those exercises is that we then start to recruit an arm and a leg at the same time. So let's have a go at that, shall we? So here we go. From this position, again, I've got my arm and my legs outstretched. I'm going to engage the core muscle, and now what I'm going to try and do, keep that shoulder blade posted in my back pocket. I can bend the knee to 90 degrees, and then I try and lift both together and hold, aiming for about 10 seconds or thereabouts, and then back down again. And then you've guessed it, we've done one side, so now we do the opposite arm and leg. So again, I'm going to bend my knee to 90 degrees, and then keep that shoulder blade in my back pocket, and then engaging that core, I lift both of them together, hold, 10 seconds, and then back down again. That's good. So we can practice that with the shortened lever length of the leg. Another way we can progress that as well is by having the leg straightened. So let's do that, shall we? So here we go. Keeping the shoulder blade in your back pocket, engage your core muscle, and lifting a leg on the opposite arm. And back down again. And now the same on the opposite side. Here we go, engaging the core. And back down again. So those are the various progressions that you can try laying on your tummy. Definitely go on the guidance that your therapist has given you. And this is very much about good control, good posture throughout. So even though temptation is often there to try and rush into the progressions, it's good to focus on the basics, and we can increase the amount of effort placed on those multifidus muscles by increasing how long we hold it for, the number of repetitions, and how many times a day that you're doing it for. Because we're looking at muscle strengthening, we'd be looking at least 10 repetitions ideally, and again, probably good to try and do them multiple times a day. So if you're trying to do them 2 or 3 times a day, that would be a good number. But again, I'd always defer to the guidance you've been given specifically by your therapist. So hopefully that's of help, and maybe it's time to show you some progressions in 4-point kneeling.